Hi, everyone. Good morning. Today, we're joined by Dr. Brett Parkinson to speak around the COVID-19 vaccine and mammograms specifically. There's been some new data that has come out from Intermountain Healthcare, and we're going to discuss what that means for you if you are of age to get a mammogram. Dr. Parkinson, how are you?
I'm doing well. How are you doing?
Good. I'm going to start with this conversation with having you just introduce yourself to us. What is your role at Intermountain Healthcare? How long have you been in this role? Just give us a brief background of who you are.
I'm Dr. Brett Parkinson. I came to Intermountain in 1991 as a breast imaging specialist. I'm a general radiologist as well, but I have fellowship training in breast imaging. I have been doing it for almost 30 years, beginning at LDS Hospital, and now I'm at Intermountain Medical Center, but I still oversee mammography services for the Salt Lake City area as well as the Intermountain Enterprise. And it's been a wonderful job. I have great support, and we have a robust program.
So you've been doing this for a while, it sounds like. So you're a great person to have this conversation with. So I want to start talking about what we're going to be discussing. There's a lot of data that has come out around mammograms and the impact that the COVID-19 vaccine has on these. Can you give us an overview of what those impacts are?
Yes, I can. When one receives the vaccination, there's an inflammatory response in the arm, and those who have gotten the vaccination can attest to that. Well, what happens is that inflammation is manifested in large lymph nodes in the axilla or the armpit area. And what a lot of people don't realize is that when we do a mammogram, we can see those lymph nodes. Ordinarily, we don't see enlarged lymph nodes on a mammogram or other imaging study unless there is severe pathology, either from an inflammation or malignancy. So when you have a mammogram right after a COVID vaccine, you can have enlarged lymph nodes. And with the Moderna vaccine, it's about 11% after the first dose and 16% after the second dose. We believe it's comparable for the Pfizer vaccine as well. Now, you're probably wondering, what kinds of problems would that cause on a mammogram? Well, in the normal situation, we see enlarged lymph nodes only about 0.2 to 0.4% of the time. So if that goes up to 11% or 16%, you're going to be seeing a lot more. And whenever we see these on a normal screening mammogram, we call those patients back because it can either mean metastatic breast cancer, which has traveled to the lymph nodes, or lymphoma or leukemia. So we don't want patients to get these false positives to have this sort of alarm. So we put out a set of guidelines for patients to follow.
And as far as those guidelines go, is this policy something that Intermountain is specifically doing, or is this a nationwide policy or recommendations that are coming out about the vaccine?
It's actually both, and we're proud of ourselves for being out in front of this because about 3 weeks ago or 4 weeks ago, we noticed that we were seeing more enlarged lymph nodes. Now, we've known historically that vaccines like the flu vaccine or the BCG vaccine, anthrax, and in the old days, smallpox could cause swelling of the lymph nodes, but not to the extent that COVID is. So we started to look at this and we realized if we don't do something, then we're going to have a lot of patients needlessly coming back for these enlarged lymph nodes. And we only have two options then. We either have to have them return, which is costly in terms of time and money, and it's an additional patient caregiver exposure, or we can postpone the mammogram. And so we early on decided a few weeks ago that we were going to institute a policy whereby we would encourage patients to get their screening mammogram either before their first vaccine or they wait 4 weeks after the second vaccine so the symptoms of adenopathy or swollen lymph nodes would subside. And on a parallel track, the Society of Breast Imaging also put out a statement that this adenopathy was being noted around the country. And their recommendation also was that patients wait 4 to 6 weeks after the second vaccine. Another thing that was happening at the same time is that those of us who were on the forum for the Society of Breast Imaging started exchanging stories, and it was happening from Los Angeles to Boston. People were seeing this. So we now have protocols in place where we are advising patients to wait for 4 weeks after the second vaccine before they have their screening mammogram. We have signage in all of our facilities indicating that. They're able to speak to one of our providers. We explain it to the patients. Now, if they insist, we say yes, but there is going to be an additional risk of being called back, perhaps unnecessarily.
You mentioned earlier too that swollen lymph nodes could potentially happen from other vaccines. Is something like this possible to happen with other things besides a vaccine specifically, or is that typically when you can see this false positive as you described it before?
Well, as I mentioned earlier, we used to see this sometimes with the flu vaccine. And any time that we saw an enlarged lymph node on one side, we would ask the patient, have you had a recent flu vaccine? And sometimes the answer would be yes. But with COVID, as I said, the inflammatory response is so much more severe that we're seeing it in 10 to 15% of patients. Other things that can cause inflammation is if you have an infection, because lymph node or drainage from the lymphatics from the arm goes to the axillary lymph nodes. And so anytime there's an inflammation or an infection or a vaccine, we will see enlarged lymph nodes. Now, as I said before, the worrisome thing is that enlarged lymph nodes in the axilla can represent serious disease like lymphoma or leukemia or metastatic disease to the axilla from breast cancer. So we don't want to make that mistake, and we can decrease the possibility of making that mistake if patients are informed. So we're getting the word out through marketing and through media outlets that this is what's happening. And we're also, telling the patients on the phone about this so they're not surprised.
A couple of questions around the swollen lymph nodes. Is this the same thing as finding a lump in your breast as well? We'll start with that question.
That's an excellent question. No, it's not the same as finding a lump in your breast. And that leads me to this. If a woman has a vaccine and within a couple of days she feels an enlarged lymph node, ordinarily an enlarged lymph node would call for a diagnostic mammogram and an ultrasound of the axilla. But if the temporal sequence is such, and you can relate the adenopathy or swelling of the lymph nodes to the administration of the vaccine, wait at least 4 weeks to make an appointment for that. If the lymph node goes away, you don't have to come in. You can have your regular screening exam. If the enlarged lymph node does not go away, then we encourage you to come in after about 4 weeks so we can work it up. Now, if a woman has a breast lump that unrelated to adenopathy, we don't want to postpone that. We do not want to delay a diagnosis of a clinically evident breast cancer by enforcing this policy for all of our patients. So if you have a lump, if you have a bloody nipple discharge, if you have scaling around the nipple, or if you have other symptoms that are worrisome for breast cancer itself, then we will go ahead and do the mammogram. It's a cost-benefit analysis that we do for screening patients for non-urgent exams or non-emergent exams. We recommend waiting. Now, if you've had a lumpectomy for breast cancer and you're coming in for a 6-month follow-up exam, we recommend that you probably wait. Or if you're coming in for a 6-month follow-up exam for something else, waiting the 4 weeks probably is not going to negatively impact your prognosis. But if it's a suspicious lump, then by all means, we will do the mammogram.
A question for you. If someone, for example, is going to get their vaccine, say next week, but they know they have an appointment coming up for a mammogram, say 3 weeks after that, what should be their next step? Should they postpone the vaccine? Should they postpone getting the mammogram? What do we suggest that this patient does?
I would suggest that they get the vaccine anyway. I think we have to look at the fire that is raging, and we want to put that out first before we attend to other problems. So by all means, don't postpone getting your vaccine if you have an opportunity to get it, because sometimes those appointments will go away if you don't take advantage of them. What I would do is, if you fall in that period where there's only going to be 2 weeks between your last vaccine and your mammogram, call the breast care centers and ask for a postponement of your appointment. And we will be happy to accommodate you if that is the case. But we do want to emphasize the vaccine should not be given until the mammogram should not be performed until after the vaccine has been given, and there has been a waiting period of 4 weeks.
And I'm assuming it's after the second dose, correct? So you get your first, if there is 2 doses, I should say.
Yeah, if there are 2 doses. So right now we only have a 2-dose regimen, but as the new vaccines come on, Johnson & Johnson, AstraZeneca, Oxford, then those will be 1-dose affairs. And in that case, we would just say, get your vaccine 4 weeks after your injection. But since there's going to be a mix of 2 shots and 1-shot vaccines, what we're going to say is you can have your mammogram 4 weeks after your last dose, which for some people coming up soon will be their first dose. It'll be their first and their last.
Another question we just got is there any concern that women are postponing their regular breast exams? And is there a concern that this recommendation will encourage more women to potentially postpone those exams?
I think if we're clear on the messaging that it is a temporary postponement, during COVID, we had to postpone screening mammograms as we shut down operations temporarily. That's because we didn't really know what the transmissibility of the virus was, so we had to take that measure. A lot of those women did have their mammograms postponed, and for some of them, it felt like the postponement was indefinite. This is a finite period of time. It's 4 weeks after the vaccine. And the thing is this is not going to affect all women, because some women are going to be getting their vaccines, 6 months before their screening mammogram or 3 months. It's only going to affect really a small proportion of women right now. And this is going to roll out over about a 7-month period. I think probably some of the last vaccines will be given in August. So this will affect maybe, could potentially affect, half of our patients if they were coming in, on any given day. But because it's spread out over time, we're going to see that it's not that big of a problem, but it's enough of a problem that we've had to make a policy.
Someone else had a question around the observation of lymph nodes and if this is helping with our broader observation and understanding of the actual coronavirus. And I'm not sure if you're able to answer this, but is there a correlation between the two with when you get the vaccine and the swollen lymph nodes that could potentially happen?
When they were doing the trials, they noted clinically, that means on exam and by patient reporting, that it was not uncommon. And like I said, it was about 11% after the first administration and 15 to 16% after the second administration. So I think what it is telling women and men, because men also get swollen lymph nodes as well, is that their body is mounting an immune response. And that's a good thing. That's why our arm gets sore after the vaccine. Now, one of the things we haven't discussed, because we're talking about mammography, is that this happens to men and women, and it may be picked up on other imaging as well, like a CT scan. Any cross-sectional imaging exam, CT or MRI, that includes the axilla will also show this lymphadenopathy. So I think clinicians need to be aware, and radiologists need to be aware, and we are now educating them to this, that this adenopathy is going to show up. Just as a personal aside, after my first vaccine, I noticed that I had a palpable lymph node in my axilla. But because of my experience with other vaccines and mammography, I knew that it was going to be short-lived. And within about 2 weeks, the lymph node was completely gone. So I did not panic, go to my internist, and ask for an axillary ultrasound. And we want to just stress to people that this is a known side effect. Don't panic when it happens, but if it doesn't resolve, then come in and be seen, and we will look at that lymph node specifically.
You kind of just touched on this with other radiology type imaging appointments. Someone asked around if there was other diagnoses that were affected by this. If someone does, say, have an appointment for an imaging for something specific, should they speak to their provider about whether they should postpone that appointment, or do we have any specific recommendations around other things not related to mammograms?
I think it's probably wise to go ahead and get the examination, because a lot of the imaging we do is for, rather urgent medical problems. Like if you're getting a CT of the chest, or you're getting what we call a a CT pulmonary angiogram to look for a blood clot in the lungs, you would never postpone that. And if you're having other problems that are pretty serious that need to be treated quickly, you could advise the technologist. Our radiologists are going to be aware of this, but I don't think that I would postpone other imaging for this. Since much of what we do in breast imaging is outpatient, and we are looking at patients who are otherwise well, postponing that exam, that screening exam, should not really be a problem. It would be like postponing your routine colonoscopy or a routine visit to your doctor by 4 weeks. We're not really asking that much, but I think that it's important that people be aware of this. Now, as I indicated before, if a patient wants to go ahead with the examination, we're not going to turn them away. We're just going to say, we will make a note of this, but if you're one of those patients who does have the enlarged lymph node, we're going to have you come back at a later time once we work it up with an ultrasound to follow it and make sure that it's not one of those other potentially deadly things like breast cancer metastasis, lymphoma, or leukemia.
I think that's really good to know too, that something like this is not a sense of if you have to reschedule the appointment, it's not going to be the end all be all for someone. And I think that's really important. But to your point, if someone still wants to come in, a patient still has concerns, that they still will do it. And I'm assuming that patient would just let their doctor know, or whoever's doing the mammogram, that they have taken the vaccine. That way you can kind of look out for things. Is that correct?
Yes. Now, in all of our breast centers around the Intermountain system, we have a sign out that says, if you have received your COVID vaccine within 4 weeks, please talk to our staff. Or if you're about to receive it, and then we'll do a history. We'll ask which arm it was in, when it was, and then we will have the patient make an informed decision given that information that we convey.
Another question we just got is, do you have a sense of how many patients in Utah might need to delay their mammograms in the next year?
I don't really know that, because like, if you look at today, for instance, of the women who walk into our center, we believe that about 10% of Utahns have been vaccinated. So 90% of Utahns have not. Presumably 90% of our women have not been vaccinated. So this isn't even going to apply to that 90% right now. And then as time rolls on, it'll just be a small percentage that will have had their vaccine within the last 4 weeks. So most of our patients won't be impacted by this at all, but there will be a certain percentage. It could be 5 to 10% at any given time, for whom this policy will be applicable, and they'll have to make a decision.
We got 2 more similar questions around breast cancer screenings being down over the last year just due to the pandemic. What is your message to people during this time, and emphasizing the importance of still getting the mammogram? Why, if you have to delay, do you still need to go back in?
You need to go back in because breast cancer does not stop because of the pandemic or because of the vaccine. It goes on. If you have a breast cancer, it grows. So do not skip your yearly screening mammogram. Postponing it by a month or 2 will not be that impactful, but postponing it by a year really could be. So if you miss your mammogram for whatever reason, we really want you to come in and we will accommodate you. During the pandemic, we had some patients who said, well, I'll just skip this year. Well, don't skip this year. As to your point about the number of people being screened going down, well, obviously in March and April, it plummeted to almost 0 for screening mammography. But we had a very robust return to business, and our total numbers this year are ahead of last year in spite of the pandemic. So at least locally, women have been getting their mammograms. Now, of course, Utah traditionally has a dismal record of eligible women getting mammograms, but I can tell you here at Intermountain Healthcare, we are very busy. And as we said last year, at about this time, to accommodate women, we are looking at expanding our hours even more. We did evening clinics. We're still doing evening clinics. And when the need arises, we'll be doing Saturdays as well. And we have done that in the past. We will do it again because we do not want women to miss their annual screening mammogram because breast cancer still kills women between 40 and 50,000 a year. Many of those deaths are needless. We know that screening mammography is the only test that has been shown over the last 30 to 40 years to decrease the death rate of breast cancer in randomized controlled clinical trials. During my 30-year career, the death rate from breast cancer has gone down by 50%. So, you know, of women who are screened, there's been a 50% reduction in mortality.
That's great. That means we're moving in the right direction. My last question for you is general information about a mammogram. If I'm watching this and say I'm in my early 30s, who needs to go get a mammogram? At what age do you start to go get regular screenings? And you mentioned before men and women. Should everyone go get a mammogram when they do qualify?
Yes. Now, men don't get screening mammography, but we do diagnostic mammography in men if they have a palpable lump, because less than 1% of breast cancers occur in men. But I'm glad that we're ending with this question because it is a crucial question to ask. Women who are at average risk for breast cancer should begin annual screening mammography at the age of 40, which is when the incidence really starts to go up of the disease. And they should continue screening every year for as long as they are healthy. We know that if women do that, that the overall death rate reduction is on the order of 40 to 50%, depending on the studies. If you are high risk, you have a first or a second, first degree relative who's had breast cancer before the age of 50, like a mother or a sister, you should start screening early, usually about 10 years before the age of onset in your relative. At Intermountain Healthcare, we're going to be doing genetic screening at the time of the patients coming to the breast care center with a very special model that will give that woman her overall lifetime risk of breast cancer. When we roll that out to the community at large, we'll find out women who really should begin screening earlier, and we will have an idea of which subset of women whose risk is sufficiently high that they should have screening breast MRI. There are new abbreviated protocols that make MRI easier. I think that will be the wave of the future for the high-risk women, is to have breast MRI as we make it cheaper and more widely available to women. But for the general population, begin at age 40. If you have a suspicious family history, consult with your physician so they can do a risk analysis to see if you should begin earlier or if you should have other supplemental screening like breast MRI.
That's really great information, and I'm hopeful that that's helpful for people who are watching this. Dr. Parkinson, thank you so much for joining us and speaking about this important topic. And if you have any questions in general around the COVID vaccine, you can go to intermountain.com/COVID vaccine. We have information and FAQs available there for the public. There's also the state's website at coronavirus.utah.gov/vaccine that talks about distribution timelines as well. Again, thank you so much for joining us, and we'll talk to you next time.
Thank you.
Thanks.